What if I told you that one routine heart test could start a chain reaction that ends with surgery you never actually needed? It happens more often than most people realize. Every year, thousands of healthy seniors walk into a clinic feeling perfectly fine. No chest pain, no shortness of breath, no dizziness, no warning signs at all. Yet weeks later, they're sitting in a hospital bed preparing for an invasive procedure they never expected. How does that happen? Today, we're exposing 4 common heart screenings that many experts say healthy, symptom-free seniors should carefully reconsider before agreeing to them. And before this video ends, I'll share 3 powerful questions that could completely change your next doctor's appointment. Let's begin. The hidden problem, the medical cascade effect. Before we discuss the tests, you need to understand something called the cascade effect. Imagine this. A healthy 70-year-old goes in for a routine heart screening. The test finds a tiny abnormality. Nothing serious. In fact, it may simply be a normal part of aging, but once it appears on a report, it can't be ignored. The doctor orders another test. That test finds something else. Then another test follows. And before long, a person who felt completely healthy is discussing surgery. This is the medical domino effect. One small finding leads to another and another, until the original question, was anything actually wrong, gets lost. Now let me be clear. If you have symptoms such as chest pain, shortness of breath, dizziness, fainting, or heart palpitations, you should absolutely seek medical attention. This video is not about avoiding necessary care. It's about understanding the difference between screening a healthy person and diagnosing a sick one. Those are not the same thing. Routine EKGs for healthy seniors. An electrocardiogram, or EKG, measures the electrical activity of your heart. It's quick, painless, and one of the most commonly ordered tests in America. Sounds harmless, right? The problem is that aging hearts often show harmless electrical variations. To a machine, those changes can look abnormal. To an experienced physician, they may simply reflect normal aging. But once an EKG report is flagged, further testing often begins. Many healthy seniors end up getting additional scans, imaging studies, or even invasive procedures because of findings that never posed a real threat. The question to ask is simple. If this EKG finds something unexpected, what would the next step be? Because the real risk may not be the EKG itself. It may be everything that comes afterward. Exercise, stress tests without symptoms. You know this test. You walk on a treadmill while your heart is monitored. The speed gradually increases and doctors watch how your heart responds. Stress tests are valuable when someone has symptoms, but when a person feels completely healthy, the results can sometimes be misleading. A false positive can suggest a problem where none exists. And that often leads to additional procedures, including cardiac catheterization. And once doctors are inside the arteries, they may discover mild blockages that have been stable for years. Suddenly, discussions about stents and interventions begin. Yet research has shown that many stable blockages can often be managed successfully through medication, lifestyle improvements, and ongoing monitoring. That's why context matters. A test designed to investigate symptoms isn't always useful as a routine screening tool for healthy individuals. Carotid artery ultrasounds. Have you ever seen a flyer offering stroke screenings at a pharmacy, community center, or health fair? Many of these screenings involve an ultrasound of the carotid arteries in the neck. The goal is to look for plaque buildup that could increase stroke risk. It sounds responsible, it sounds proactive, but for healthy people with no history of stroke symptoms, these screenings can sometimes create more confusion than clarity. Minor narrowing of an artery may never cause a problem. Yet once it's discovered, patients often feel pressured to pursue further testing or procedures. In some cases, the treatment itself carries risks. That's why many experts recommend careful consideration before undergoing these screenings when there are no warning signs. Remember, finding something isn't always the same as finding something dangerous. Coronary artery calcium scans. The coronary artery calcium scan, often called a CAC scan, looks for calcium deposits in the arteries of the heart. A higher score generally indicates more plaque buildup. For certain middle-aged adults, this test can provide valuable information. But here's what many seniors don't realize. By age 65 and beyond, some degree of calcium buildup is extremely common. It's often a reflection of aging rather than an immediate threat. A high score can sound terrifying. People see numbers like 400, 700, or even 1,000 and assume disaster is around the corner. But the number alone doesn't reveal the full story. It doesn't necessarily tell you whether a blockage is dangerous. It doesn't tell you whether a heart attack is imminent. And it certainly doesn't mean surgery is automatically needed. Unfortunately, fear can drive decisions, and fear is not always the best guide when it comes to medical care. The 3 questions every senior should ask. The next time a screening test is recommended, ask these 3 questions. Question 1. How will the results change my treatment plan? If the answer is it probably won't, that's important information. Question 2. What is the false positive rate for someone my age? No test is perfect. Understanding the chances of a false alarm helps you make an informed decision. Question 3. What happens if we monitor the situation instead? Sometimes careful observation is a medically appropriate option. Ask what warning signs would indicate the need for further action. Knowledge creates confidence, and confidence leads to better decisions. Final message. The goal isn't to find every tiny imperfection that modern technology can detect. The goal is to live a long, active, fulfilling life. More testing doesn't always mean better health. More procedures don't always mean better outcomes. The most important thing is understanding why a test is being recommended and whether it truly benefits you. So here's your challenge. Before your next doctor's appointment, write down these 3 questions and keep them somewhere you'll see them. In your wallet, on your refrigerator, next to your medications. Then use them every time a new test is suggested. You may discover that your healthcare conversations become more balanced, more informed, and more focused on what matters most. If you found this video helpful, share it with a spouse, friend, sibling, or parent who might benefit from hearing it. And don't forget to subscribe because our next video reveals the everyday habits that quietly strain your heart, and most people have no idea they're doing them. Stay healthy, stay informed, and I'll see you in the next video.